nurse practitioner here at Rejuvenation MD, and today we're doing Botox for our patient. We're going to be treating the glabella and then around the eyes and then also down here, and I'm going to clean her skin and kind of explain where I'm going to inject and why as I do it. We use hypochlorous acid for cleaning the skin. It's the gold standard in medical aesthetics for not damaging the integrity of the skin, but still cleaning it in an aseptic manner so that our injections can be administered safely into the skin of our patients. So as I was talking to my patient before we started filming, she was telling me she gets these kind of wrinkles right here above her eyebrows. Raise your eyebrows for us. So sometimes this is a concern for our patients, and you'll see what I'm going to do is I'll inject above here, and that's going to help prevent this from being as pronounced. She also isn't a fan of the downturned corners of her mouth, and as we age, this area can look a little heavy for many of us. There's muscles right here on either side of the mouth that pull the corners of the mouth down and contribute to this whole area looking a little heavier than it needs to, and so we can do an injection into this DAO muscle here on the sides of the mouth, and that can release it and just turn the corners up just slightly. That's a nice look for a lot of our patients. So I like to oftentimes look with my patients in the mirror and have them tell me what it is that's bothering them, which we already did, but for our purposes, so frown for me. So frown really hard. So these muscles here are the muscles that are pulling down and in like this. So we inject this muscle group, the glabella complex here, to help prevent these wrinkles from forming. And then because she has, raise your eyebrows, because she has this mark here that she doesn't like, will come in outside and above that, laterally and above that. These horizontal lines are caused by the frontalis muscle that raises the eyebrows. Sometimes our patients might have a heavy eyelid, and so when we stop this muscle from raising, it makes that eyelid a little too heavy for them. They don't care for the way that looks. So we won't inject the frontalis muscle. There are other tricks we can do by injecting under the eyebrow, and that will help open the eye up, and sometimes that's just enough to allow us to continue injecting the frontalis but lifting the eyelid enough. So there's different variations on what we can do to help with these muscles here. And then some frown for me. So, and then we'll just inject into the muscle right here, and that'll help with this muscle that pulls down, and then we'll do around her eyes later. Frown really hard. There you go. I'm just looking at the way her muscles lay and planning my injection pattern around there. We want to come in at the tail of the corrugator muscle on both sides, and that's kind of what this shows me, is where does that action stop for that corrugator muscle, and then I know I'm going to come in just on the other side of that. And then raise your eyebrows up high for me again. Relax. Okay, so sometimes people think that I'm going to inject them with this very enormous needle, but it's just used for drying it up, mixing and drying it up. Then we use a very tiny, short needle for the actual injections. But I try to do all my preparation kind of behind my patients so they don't have to see the needles, so that kind of can help people not be quite so nervous too. I think a question we commonly get asked is it going to hurt? And I think it's very well tolerated. I don't think it tends to be very painful for people. 2, 3. So how was that? Is that not too painful?
Not at all.
2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.